Hello everyone, I'm Bishra Jangut, and today I'll be talking about the role of aspirin in CABG patients and when to consider adding Plavix. So the antiplatelet therapy is a key component of both primary and secondary prevention in coronary artery disease. And aspirin is the cornerstone of antiplatelet therapy and is recommended after CABG surgery. So aspirin irreversibly inhibits platelet COX-1, and by reducing thromboxane A2 production, aspirin prevents platelet aggregation, lowering the risk of stroke and MI in patients with ischemic heart disease. And dual antiplatelet therapy further enhances platelet inhibition and may reduce the risk of cardiovascular events. However, evidence supporting the use of dual antiplatelet therapy after CABG is limited. So when deciding whether to use dual antiplatelet therapy after CABG, it's important to consider the patient's clinical indication for surgery, whether it's due to acute coronary syndrome or stable ischemic heart disease. The timing of therapy initiation may be influenced by postoperative bleeding. However, in general practice, aspirin should be administered preoperatively and within 6 hours after CABG in doses of 81 to 325 milligram daily. And it should then be continued indefinitely to reduce graft occlusion and adverse cardiac events. And several meta-analyses suggest that dual antiplatelet therapy after CABG may reduce vein graft occlusion, with the greatest benefits seen following the off-pump CABG. So there are two types of CABG surgeries, on-pump and off-pump. So as name suggests, off-pump doesn't require hard-lung machine, and surgeon operates on beating heart. In contrast, on-pump does require hard-lung machine, and the machine takes over the heart's function during the surgery. So compared to on-pump CABG, off-pump CABG is associated with hypercoagulable state, and partly due to reduced platelet dysfunction, decreased systemic inflammatory response, improved hemostasis by reducing the activation and consumption of clotting factors and platelets associated with bypass machine. So actually, platelet dysfunction and clotting disorder can be beneficial in protecting the anastomosis and preventing the bypass graft thrombosis after CABG. So therefore, early initiation of aspirin and Plavix after off-pump surgery has been shown to reduce postoperative cardiac events. Thank you.